Anterior compartment of the arm with our biceps brachii and the brachialis sandwiched in the middle, and then the back, the posterior arm, has just the triceps. So here's the biceps brachii, two heads, two origins. When you look at this muscle model, you should see, okay, this is so this is going to be my chest starting. This is the medial side. So here's my medial head of the biceps. This is my lateral head. So this is medial, so this is the short head. Lateral is long. Short head, long head. You can see the brachialis here or on the side. Okay. So it's the same muscle. And then here's the triceps. So triceps, there's three heads. 1, 2, 3. Okay, so here is going to be our most lateral. So this is going to be the lateral head. The most medial is our medial head. And the one in between, the longest one, is the long. Okay, so we have lateral head, long head, medial head. And those are your triceps. All right. So if we want to do the forearm, the trick I was telling you guys was to put 1, 2, 3, 4. So PF, PF. Okay. And so our first P is pronator teres, flexor carpi radialis, because we're on the radial side of the thumb, palmaris longus, flexor carpi ulnaris. Okay. Then our one guy underneath is right here, so you can see him poking through, and that's our flexor digitorum superficialis, right? That goes to our middle phalanx, digits 2 through 5. If we want to see our flexor digitorum profundus, we need to lift this off, and it's right here. Okay, so flexor digitorum profundus. That's going to go to the distal phalanx, digits 2 through 5. Then the next big muscle you can see here is this guy, and so this is going to be responsible for digits 2 through 5. This one's going to get number 1. So this is your flexor carpi, flexor pollicis longus. Flexor pollicis longus. The other guy that's kind of hanging out or hiding, number 29 in this little area, that's your pronator quadratus. It should span right underneath all of these tendons to pronate the forearm or the hand. The other things you can see are the flexor retinaculum, this white connective tissue, and then all the muscles here at the base of the thumb are your thenar eminence. All the muscles here are your hypothenar eminence. Okay, so that's just that's your anterior forearm. If we want to flip it around, find your muscle that's going to divide your anterior compartment from your posterior compartment, which is this one, okay? And this is your brachioradialis. This is going to shape basically the side of your forearm. And then here we're flipping around to the posterior side. Okay, we have our brachioradialis here. Then our first two in are going to be our extensors. We have extensors on this side. Extensor carpi radialis longus, extensor carpi radialis brevis. Okay, so we have two extensors on the radial side. Then if you go into the middle, you have your extensor digitorum, extending the digits 2 through 5. Extensor digiti minimi, a small muscle, a small name. And then we have extensor carpi ulnaris. And then we have our anconius. Okay, so we have our two extensors, extensor carpi radialis, extensor carpi ulnaris, and we have some smaller muscles in between. So let's look at the deeper ones. You can kind of see the muscles coming out underneath going to the thumb. So let's look at those. All right, so the first biggest muscle up in here is the supinator, okay, to supinate the forearm. Then we have our 1, 2, 3, 4 in a row, okay, all these. So the second one here doesn't have a number, and I don't know why. So we have this is all 1, 2, 3, our 3 going to the thumb. These tendons make up that anatomical snuff box. So this is abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and then extensor indicis. Okay, so it's thumb, 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 index finger. Right, and that's basically it. Then we have the extensor retinaculum, and that's it. Okay.